Professor Peter Piot has used his life to bring science to the people. He's transformed the world and given us the chance to live, and with purpose. He co-discovered Ebola in 1976, the year it first appeared in what was then Zaire, followed by research and leadership on HIV and AIDS. His book, No Time to Lose, documents this extraordinary journey, but it now has an update after Peter was infected with COVID-19 and continues to live with the longer-term consequences of a disease we're beginning to understand. On a personal note, he brought me into AIDS and global health, and more importantly, he has done the same for many more young people whose lives today are a testament to his. So it really is an honor for me to bring you this conversation with Peter Piot. After we emailed while you were on the way to the hospital, I thought about you so much over the days that followed. And I thought so much not only about your career, but how you've contributed to science and humanity in a way that very, very few people have managed to achieve in a lifetime. Did you ever imagine that you yourself would one day succumb to a new virus in the year 2020?
Perhaps, after having fought viruses for most of my adult life, made their life miserable, maybe I became overconfident that they couldn't get me because I've taken care of patients with Ebola, at least in '76. I had really lots of contacts with people with various infectious diseases. So I must have been very, very lucky. And then I thought, okay, this is the revenge of the viruses. But the virus is still here. It's still around. And as long as there is one person on Earth who is carrying this virus, it's a risk for the rest. Because let's think it through. What's the purpose in life of a virus? An existential question. And that is to find a host, a living being. It can be a plant for some viruses, animals, or us human beings, because viruses need living beings in order to survive. And so they will always try to infect people.
A couple of days ago, the World Health Organization confirmed well over 200,000 cases, and those are just the cases that we know of. Africa, a region that you've worked with richly, a region with fragile health systems and devastating health burdens in some parts before COVID-19. Is it too late then to reverse the damage that's being wreaked there?
I already lost three friends due to COVID-19 in Africa, one in South Africa and two in Congo. I mean, that must be the tip of the iceberg because all three were professionals, colleagues, active in AIDS research, or in Ebola work, and I'm very concerned what's going to happen. It's a bit of a miracle that Africa has not yet experienced a major epidemic because the classic approaches to COVID-19 with so-called social distancing, that's out of question when you are in a township, as it's called in South Africa, or in a Khayelitsha in Cape Town, or a slum area like Kibera in Nairobi, places where I've worked, or in the big cities. It's very hard to do that. On the other hand, I must say that some African countries have really stood up to the challenge, have installed measures that certainly in the West, countries have waited for too long. But will it be enough to control it, to stop the wave that is coming up now? I doubt it.
But I'm wondering, what is the second line of defense? Is there a second line of defense if we don't develop an effective vaccine, if it's not necessarily manufactured, rolled out, and made available to everyone? And Peter, you yourself have said this as well. It's not necessarily going to be acceptable to everybody. And if people choose to opt out, then the pandemic has a chance to live.
Yeah, as much as I believe that a vaccine against COVID-19 is going to make a huge difference, I don't think it'll be a silver bullet, a magic bullet. And why am I saying that? First of all, it's unlikely that the vaccine will be 100% protective. So even with a vaccine, we will have to continue to respect certain rules. But the truth is also that we're only at the beginning of this epidemic. And the way I think of it, and that's probably inspired by our collective experience in terms of HIV, is that from an epidemic, HIV has become endemic. It's there. And so we'll have to go to societies living with the COVID-19. To wipe it out, that's going to be a very, very hard act to achieve. Because let's not forget, there's only one viral infection that has been eradicated, viral infection for humans, and that is smallpox. Even polio, despite billions and billions and a good vaccine, is still not, wiped out. And I think the wearing masks, as has been a tradition since particularly the Spanish flu over 100 years ago, in Japan and some other East Asian countries, I think should become part of our culture and of our behavior. Some kind of social distancing, maybe handshaking, that belongs to the past in Western societies. In other societies, that's already a long time gone, if it was ever there. And we'll have to be very alert to any new cases of COVID-19, and then immediately act where they are. So what we need is good intelligence, in other words, knowing where is it starting again, and then immediately try to contain it there, so that we don't have to go for this current bulldozer approach where a whole country is locked down. That is also has enormous negative consequences. Look just at the economy and could push people into poverty, prevent people from seeking healthcare for stroke, heart problems, and so on, and cancer, and therefore also cause mortality. That's why the title of my memoir is No Time to Lose, because if you can prevent the early cases to transmit to others, then you actually prevent thousands, maybe millions of cases that could come afterwards. So that means that's an investment from governments, from society as a whole, combined with some kind of discipline to protect yourself and to protect others. Is going to require a massive behavior change at all levels.
You can listen to the full conversation with Peter Piot at thechinacurrent.com or your preferred podcast platform. Thank you.